afternoon. Welcome to Facebook Live. It's Friday, June 19th on the Oneida Nation Reservation in Wisconsin. And we're here today to talk about the COVID communication core team, what they do, how they operate, a little bit of history about us. So for our health update, we've got Michelle Myers, who's the Public Health Officer. We also have with us members of the core communications team for the COVID-19 pandemic, and that's Lisa Summers, Melinda Danforth, and Lisa Liggins. So when we're done with our health update, Michelle is going to step away from the table. We're going to wipe it down, sanitize it quickly, and then Lisa Liggins will join us so that we keep our social distance here today. We wanted to remind everybody to be very respectful and to make sure your questions and your comments and your solutions that you offer are all relevant to what we're talking about here today. We've had some questions about when some of the other businesses are opening up. As soon as we hear, we do include those messages, we do include those announcements. So if we haven't heard, it means it's not happening yet, why people aren't being called back to certain departments and why people are. So we hope that you've got the patience that we have with you today to make sure that we bring people back when it's safe. And the safer at home has been extended, and we want to make sure that everybody knows how much we appreciate that. There's been a surge around the country in other states where they are, again, for the second time, closing certain businesses because it's gotten out of hand again. So we want to talk about what's happening here, our medical update, and some of our numbers, and we're going to start right now with Michelle, our public health.
Thank you, Bobby.
You're welcome.
Good afternoon. To give you some statistics, some numbers from today. Globally, there are 8,513,725 confirmed cases. There are 454,513 deaths globally. In the United States, there are 2,191,200 positive cases with 118,435 deaths. For Indian Health Services, 16,199 confirmed cases. When we break that down further, the Bemidji area has 304 confirmed cases. Albuquerque, 897 cases. The Navajo Nation, 7,646 cases. Phoenix, 3,495 cases. In the state of Wisconsin, we have 23,876 cases with 719 deaths. Outagamie County has 366 cases with 8 deaths. Brown County has 2,520 cases with 39 deaths. When we break it down specific to the Oneida Nation Reservation, Oneida Nation in Brown County has 20 confirmed cases with no deaths. We also have no one in isolation currently in Brown. In Outagamie, we have 27 cases, 2 deaths, and no one is in isolation in Outagamie County. Ongoing evaluation of available data guided a decision to extend the public health emergency and the Safer at Home order for the Oneida Nation until July 12, 2020. Oneida's Safer at Home order affects tribal members and all businesses on the reservation. Under the current Safer at Home order, essential businesses remain open. However, as you know, those services may be provided differently. As we have moved forward in this pandemic response, the non-essential businesses have been allowed to open under the Safer at Home order. These businesses must submit a plan to me, the public health officer, and agree in writing to follow the specific guidelines for the industry that that business is. So for example, the industry of restaurants. There are guidelines specific for the restaurants, specific for retail stores. As we move to a more open environment, it's important you take steps to protect yourself and others from COVID-19. Wear a facial covering when out in public. Practice social distancing. Avoid gathering in groups larger than 20 people. Wash your hands frequently. Cover coughs and sneezes, and regularly clean high-touch surfaces. I have just one update for the Health Division today. There will be a change in hours of operations for our COVID drive-through testing. Beginning today, the site will be open from 1:30 to 3:30 p.m. This change comes as a result of less demand for testing and the need to optimize staff in other areas in the health division. So with that, I'll turn that over to Lisa.
Thank you very much, Michelle. And thank you everybody for joining us again this afternoon. We really appreciate that the community does take the time out to join us every week. We've been doing these Facebook Live events now for several weeks. And we started off at 3 times a week, and now we've switched to 2 times a week. And we continue to provide critical information, hopefully as much real time as possible. So for that, I do want to thank our team who continues to work with us. And then just to reiterate a little bit, as Bobby had stated earlier, as we introduced the topic for today, which is the communications team, is to really thank the community for their continued diligence in making sure that we do things like wearing our face coverings, making sure that we're practicing good hygiene, continuing to stay in those smaller groups and following the safer at home order. Michelle has been able to deliver some phenomenal news, which is we have no people in isolation at this point, and we've had a downward trend in our numbers, and that's really attributed to all the hard work that the community is doing, and really the support that you've been providing to the government and the operations and the health team and our health officials in taking the message that they've been providing seriously. So with that, I do want to just go over a little bit of information about the role of the communications team and who we are, what we do. And really there's 4 primary roles on the communications team. And when we were first formulated, we looked at those 4 areas and we said we need a connection between the government and the operations. We need a public relations specialty on our team. We need an intergovernmental affairs and communications specialty on our team. And we also need a technical support aspect of what we do. So those are the 4 primary areas that we looked at when we determined the communication team members and what would be our primary roles and responsibilities. And when we look at that, we really have to also acknowledge the support and the role that the entire organization has really provided. And you know, whether it's the health team or aging and disability resources or the school, or you as a community member, really providing us feedback and information and letting us know those things that we need to do to improve. It's been all very helpful, and we've been able to follow up and get those things accomplished and addressed. And so one of the things that I wanted to just very quickly touch base with you on, and you can't see this probably very well, but I'm going to just let you know that there is a method to the madness, so to speak, from the communications perspective. And as you can see here, we get information that's coming into the Oneida Nation from all different kinds of sources. And whether it's the Oneida community, the general public, questions coming in from our operations, whether it's our state, our federal, our tribal partners, and even our employees and other important stakeholders like our vendors. We have all these questions that came in when this crisis first started happening. And as you can see here, our team's role was to intake all of that information, make sure that we're filtering it and getting accurate information, and then pushing it back out into those areas where they were coming in from. So, you know, hopefully that just gives a little bit of visual, and we'll try to get that posted for you so you can kind of see how the flow works, and then you'll be able to share that, and you know, hopefully that helps answer some questions about what we do and how we do it. But I also wanted to share some specific examples of some of the significant changes that we implemented and that we did. One of the things that we collaborated on is making sure that the webpage really had an adjustment to it so that when you went to the tribe's webpage, you could see the COVID information was put on the forward-facing banner, and making sure that it was prominent and you're able to see that. One of the things that we helped do is make sure that there was, through the continuity of service in government, we transitioned schedules and we made sure that they were fluid, and we made sure that that information got pushed out as well. Everybody's hours of operation changed. Their service delivery style changed. All of those kinds of things were coming in on a regular basis and still are. The other thing that's significant to note is that we did establish the hotline, and we did establish the COVID-19 email that people can send their questions to. HRD has a very specific email, as well as gaming for their employees as well. Please continue to use that hotline number. Please continue to use the email address. And as always, you can reach out to individual community members or business committee members as well, and we will do our best to make sure that we continue to follow up and get answers to you on a regular basis. And then the last thing that I wanted to clarify for you all, and this is one of the questions that kind of popped up early on when we were going through the questions about unemployment when we first were going through the layoff process. And I just wanted to clarify some things about the employment questions, because we did get several of them in from people. And one of the inquiries that we got was why we weren't necessarily answering specific inquiries about employment on the Facebook Live sessions. And really that had to do with the fact that everybody's individual employment situation is different. And because it's different depending on their location, hours, things like that, what their individual procedures might have been in their area as far as selections, and then of course we really don't have specific answers regarding unemployment. That's the state. So I just wanted to make sure that there was clarification around why we didn't necessarily answer those. But again, for anybody that has employment related questions out there that you continue to have, please continue to use the hotline or the email. We do the follow-up. A majority of time you'll actually get a live person. So that's something that we've been very diligent about. Our hours have slightly changed, so if you call after hours or on the weekends, please leave a voicemail and we will follow up on the next business day. Another specific example that I wanted to give you is that over the last couple of Facebook Live sessions, many of you have been asking about the Oneida Market and when is the Oneida Market going to open. So we've been able to facilitate an answer for that, and I am, able to announce today that the answer that we were able to obtain from those people that oversee that area, from the management in that area, is that as we continue to look at the financial impacts and do those cost-benefit analyses and do things like making sure that we're spending our travel contribution wisely, is that the Oneida Market specifically is showing that by doing a full opening of the market, we are not going to be able to continue to be profitable in that area. So it is more beneficial for us at this time to continue to put products in the Larson store and have them sold that way. Now, the other thing that I'm happy to share with you as well is that we were able to provide the feedback that you have been presenting to us to management. And we've been letting them know that individuals still want to have access to things like the teas and the different kinds of medicines that we have there, or the other products that aren't currently located in the Larson store. So management did let us know that they've heard the questions, they've heard the requests, and they're actually working towards an online platform where you'll be able to order products from the market and then be able to do pickups. So that is being developed, and as more information becomes available about that particular question, we'll be able to share that as we go along. And then I think the last important thing that I wanted to talk about you as we look at the way the team organizes information is that we're ensuring that we're covering the major critical needs in the community. So again, we did send an initial report out, report 1, and I'm not going to go into a lot of detail with that because I believe one of our other guest speakers is going to do that. But we are planning on doing a follow-up report to that for our tribal memberships. And topics that we've covered to date and will continue to cover are things like continuity of service and government, the health pandemic itself. Again, we continue to have a health aspect of this update every time we do this communication. And then doing things like making sure that reminding people that we've taken steps to do things like rent and mortgage relief. And for those that have been questioning, well, there's people that don't necessarily live on the reservation, or the program that we've been able to impact to date is not an Oneida program, and is there going to be something offered for that? And the answer is we are working on that. So we've taken those things into consideration, we've heard the feedback and the messages, and we will continue to pursue those things. That includes utility relief. The food security team has done a phenomenal job. We had our final distribution today, over at Waddle Circle Place and the Food Distribution Center and our partnership with Feeding America. So I thank that entire food security team for that. That was one of their initiatives that they worked on, and it's really appreciated in the community. And that is it in a nutshell. Now there's an entirely different or another area that also assists with this, and that is Intergovernmental Affairs and Communications. And what they do is, as part of their role here, is assist with information and the facilitation of that response from local, state, federal, and other tribal partners. So with that, I will turn it over to our Intergovernmental Affairs and Communications Director, Melinda Danforth.
Yonko Secretary Summers, appreciate the information that you provided to the community. As part of the team and in my role as Intergovernmental Affairs Director, I am able to provide that link and share information from the federal, state, and local levels of government. Our role is to engage, lobby, and educate our congressional, state, local, and tribal representatives about how the nation, our community, and our employees are being impacted during this pandemic, so we can bring the necessary resources that are available to the nation. I wanted to provide a few examples of how our COVID-19 communications team has been working. So I would like to provide an example. The nation recently lobbied Congress with other tribal nations and tribal national organizations to advocate for legislation that would provide dollars to assist us during this pandemic. During the development of the CARES Act funding, or otherwise the coronavirus relief funding, and other funding sources that were provided by federal agencies, we were communicating with our congressional representatives, ensuring that tribal nations were included in the legislation to be able to receive the dollars. We also engaged with our state partners, and Governor Evers became a big advocate to assist in lobbying Congress to ensure that tribes were included in the legislation as well. As the legislation became law, rules and guidance from the United States Department of Treasury were issued, and we organized that information and provided reports to the tribe's decision makers so that processes and teams could be developed to ensure that we receive the dollars appropriately, and we developed a plan and an appropriate process to distribute the dollars under the rules that have been developed. Another example of our team's efforts was to assist the nation in collaborating with other tribal nations. When gaming operation closures were being determined, our team collaborated with the health team, the emergency management team, and looked at the COVID stats and data to assist in providing necessary information to determine how the nation would respond and mitigate the potential for gaming customers to transfer play between the gaming operations between us and other tribal nations, and also what it could have resulted in potentially contributing to the spread of the COVID-19 virus. We also work with the state of Wisconsin. The Wisconsin tribal leaders meet with Governor Evers on a weekly basis to discuss issues related to the COVID-19 pandemic. We talk about issues such as the development of the safer at home orders. We talked about the operational closures and the impacts such as closing the schools, closing gaming, closing and reopening businesses. We talk about unemployment issues, COVID-19 testing, contact tracing, and health guidance that's being provided by the Wisconsin Department of Health Services. And then we talk about any rules that might be impeding our ability to respond effectively to address the pandemic impacts here within the nation. The nation also has direct access to the Lieutenant Governor and to all of the agency's secretaries. Our role is to work with tribal and organizational leadership to identify any issues impacting us and to coordinate a resolve to those issues between the nation and state officials. And then we come back and we re-communicate that information back to our internal and external parties to ensure that we're taking appropriate actions to implement those resolutions. Much of the information that you've heard so far has been transferred into reports that are being submitted to tribal members, such as this one. This tribal member report can be found at the tribal members only website, and then also was mailed directly to households. As As Secretary Summers had said, we are in the process of developing a second report, and a second report will be distributed relatively soon. Along with these types of responsibilities, our team also performs a number of administrative activities. And I'll now turn it over to another member of our team, Lisa Liggins, the nation's information management specialist, to discuss the administrative activities of our team. Yonko.
All right, thank you, Melinda. Through this COVID-19 pandemic, we've had to adjust quickly on the way we conduct business. Primarily, we've been conducting meetings virtually via Microsoft Teams in order to properly social distance. So we'd like to thank MIS for all their support in getting everybody on Microsoft Teams, providing training, and providing support all during the working hours and after hours and on the weekend. In addition, more discussions had to be organized, such as weekly BC work sessions so that the BC can be in contact constantly. The COVID core decision-making team needed to meet regularly, and we as the communications team have housed ourselves together socially distanced in the BC conference room so that we're face-to-face, we can communicate quickly and effectively, and that we can man the phones and the emails that come through. We also vet notices related to COVID-19 to make sure that they're clear and informative. We also address the technical challenges that come up. For example, if we have a meeting and someone isn't on Microsoft Teams, we work to allow another way for that individual to participate, whether it be teleconferencing or another form of software. And that's, again, working with MIS closely with that. More recently, we've been working with IGAC and records management to address the audio-visual issues that have arisen due to the changes we needed to make in the BC conference room meetings and in addressing Facebook Live. Facebook Live is new for BC meetings, so we are looking at options on how to move forward with streaming our meetings in the future. Through all this, we're continuing to comply with the tribe's laws and policies, specifically the Open Records and Open Meetings Law. It's important to have transparency with our constituents, so although people cannot come to the meeting and participate for BC meetings, we do have it noticed on the website and on the agendas that you can submit your comments to tribalsecretary@oneidanation.org in order to have your voice heard by the BC members. Through all this, we have the COVID-19 call center open, so if anybody is unsure of who to contact, what is open, or what your next step should be, feel free to contact us at that number. I'm sure it's in the comments below, but it's 920-869-4481, or you can shoot an email to covid-19@oneidanation.org. Those are for non-healthcare related issues. If you have healthcare related issue concerns, you need to contact your primary healthcare provider. And that is a nutshell of our administrative and technical support.
All right, thank you, everybody. As Lisa said, that's a nutshell. That's not everything. We've been working since actually late January and February addressing what was coming. We didn't know the pandemic would impact the Oneida Nation to the extent it has. We had no clue the world was going to be impacted to the extent we have. The whole nation, the whole world communicates differently. New laws had to be put in place, new policies, new processes. With the loss of our income, we had to figure out how to reduce our workforce, and now our workforce wants to come back. We keep saying, when will you call back this group? When are you going to open that up? We don't know. For us to return to the normal might be where we're at today. We can't say. Our income is week to week. Our gaming has been investing a lot of their capital into making sure that they can continue to operate in a safe, healthy manner. There, if you go into the casino, you'll notice that there's plexiglass that's now being installed. As it comes in, the workers are taking it and they're putting it between the machines. It's a day-by-day process in some respects. There's been a lot of planning. Excuse me, but as you know, when you plan something, Plans don't always go the way you want them to. Maybe you planned a vacation this summer. Maybe you plan to take your whole family to Disney. Maybe you wanted to go to Great America. Plans changed. You're not going to do that because of the pandemic. You don't have the income that you had before. You plan things, but even our best laid plans have gone astray. So we want you to understand that there's a lot of time, a lot of effort, and a lot of people who are working pretty diligently to try to address employment, especially the CARES. We get a lot of questions about how we're spending that CARES money, how much we got, where it's going. Other tribes are doing this. Other tribes are doing that. Why can't we do this? Why can't we do that? Well, we're not other tribes. We're much larger than many of the other tribes in the state of Wisconsin. The Oneida Nation is the largest tribe in the state of Wisconsin. We have over 17,000 enrolled citizens. Some of the other tribes have 2,000 or less, or 6,000. They have a lot less. Some of them don't have the land base. Some of them don't have a police department. They don't have the extensive healthcare services. They don't have a nursing home. So to compare the Oneida Nation to the other tribes isn't relevant. It isn't fair. We have to look at our 17,000 citizens and how we can best serve them. And it's not easy. We're stretching our dollars as far as we can. Our human resources, we're stretching them. We're working very hard to communicate to you. There's probably not another tribe in the state of Wisconsin that gets the level of communication that the Oneida Nation does. Every week we get on Facebook Live twice a week. We try to get our Cully Weesox going. We post on Facebook. We post on our website. The documents that you see today, those will be posted on the COVID website. That was a question that was answered. Yes, we will post those. But it's a difficult road to hoe for us all. We sure appreciate the prayers and the support, and we get a lot of encouraging comments, a lot of solutions. A lot of people are grateful for what we're doing, and that makes us grateful. It makes us feel like we're making a difference in the Oneida Nation. We're making a difference in the world. Some of the questions that have been coming in were relative to a lot of employment issues. Debbie Thundercloud is the general manager. She'll be on Facebook Live next Friday, June 26th. We hope that she can get some of those questions about the tribal operations answered and have some of those resources available for us. We also were asked a question, I can't answer this, and I'll pass this off to Lisa Summers, our secretary, as to how soon GTC meetings might be resumed and what do we think that might look like. Lisa?
Thank you for whoever asked the question. Sorry, I'm caught on my own ear in here. Forgive me. Thank you for the question about the General Tribal Council meetings. This is one of the items that we are being very cautious about and wanting to make sure that we're moving very carefully and methodically. And for General Tribal Council meetings specifically, we are going to continue to rely on the assessments that we receive from our healthcare experts. We have received to date at least 2 assessments, and we've been asking for those assessments to come on a regular basis. About every 6 to 8 weeks, we've been getting an update, and we're getting closer to if the trends continue the way they are, and everything continues to move, and we don't have another spike or anything like that, we could look at late summer, early fall as being able to have our first General Tribal Council meeting in a while. Now, maybe people don't remember, but when we first decided to start postponing the General Tribal Council meetings, and this was contained in the report 1 that was sent to all tribal members, we were very clear that we would rely on health officials to help us make those determinations. And right now, at this point, the very first assessment that we received from our health team was that they would not recommend large gatherings of more than 50 people at this point until at least between 3 to 6 months. At that point was the first assessment, which put us into October of this year. So if we continue to stay on track the way we are, we would have another assessment scheduled for about late August, early September for that next assessment on is it safe and proper for us to be able to bring larger groups of people together to have things like a General Tribal Council meeting. So we will include that next step in the business committee transition files so that the incoming council knows that's one of the things that they are going to need to work on in order to continue to proceed with down that path. Now, the other thing I just want to touch real quickly on regarding that specific question is that there are potentially other platforms or other ways to hold general tribal council meetings, and we are looking at those things. The biggest question that continues to arise as we explore other things like online platforming, specifically, is the confidential nature of the general tribal council meetings in general. The tribe, the nation as a whole, our people as a whole, the body as a whole, has a very, very long-standing and strict history of making sure that our general tribal council meetings are only for us. And that's a tradition that we honor and preserve at every turn, and that's part of the decision making as well. So we have had a few suggestions, and again, we are exploring them and thinking about, ways to do this from a virtual perspective. But one of the things that is a challenge for us, because we haven't been able to have a conversation with the members, is, with that change in course, if we were to go that way, is there would be the possibility of giving up that long-standing tradition of being close, our meetings being close to the general public. So I guess I would encourage people to think about that, keep that in mind. We will be looking for feedback at that at some point in the near future for that, as we continue to go through assessments and tackle these kinds of issues. So thank you for the question.
All right, thanks, Lisa. Good answer. Melinda, I'm going to throw you a question that's I'm not quite sure how to answer, but I think you can probably do the best at it. There seems to be some confusion about the money that the tribe's receiving from the COVID. It's been called COVID stimulus dollars. It's been called the CARES Act. It's been called a number of different things, and people are a little confused about what about all this money the tribe is getting? How are they spending it? Why aren't they calling people back to work? Can you maybe, and I know you explained it. I know it's been explained. It's been in the things that we've mailed out. We've answered it every week, but I think the more we address it, it's gonna click again. So different people listen in at different times. So if you could maybe address that, how it's being spent and why it isn't being used to bring everybody back to work, or the restrictions on it.
Sure. Again, thank you for that question, and we continue to get that question every week during Facebook Live. And we've been directing people to look at the United States Department of Treasury website. So under the CARES Act, which is a federal law that got passed, there was money set aside for tribal governments, $8 billion in total. And that money was sent over to the United States Department of Treasury to distribute to the tribes throughout Indian country. With that came rules about how the money could be spent. And in particular, a lot of tribes are struggling to spend the dollars within the rules. The rules are, one, that it has to be an unbudgeted expense. So it couldn't have been budgeted in our recent fiscal year budget. And it has to be spent on COVID-related expenses only. So COVID-related expenses would be things like the personal protective equipment that we might need for our workers outside of healthcare, because we did receive dollars for healthcare PPEs, but things like retail, the Oneida Police Department, those types of entities, employees that continue to work in DPW and custodial, plexiglass barriers for the gaming reopening, for other business reopenings or office reopenings, disinfectants that we didn't expect to have to purchase during the years, unemployment costs because of the pandemic and layoffs that are occurring across the country. Those are the type of expenses that this legislation and this money was geared towards. Unfortunately, one of the biggest questions that continues to come up is, well, we lost revenue. That was a COVID-related impact, but Treasury clearly indicated that the monies could not be used for loss of revenue due to the pandemic. The monies have to be, the expenses had to have been incurred between March 1st and December, at the end of December of 2020, and the money has to be spent by the end of December 31st, 2020. So those are the rules and guidance that the Department of Treasury has laid out. So we could utilize the dollars for things like providing meals, providing shelter, making sure that the basic needs are being met. So questions about, well, why can't we use the money to bring back employees? Again, it has to be a COVID-related necessary expense. And if the position doesn't deal with a pandemic, in particular is not dealing with a pandemic issue such as emergency response or healthcare, or an essential worker that might be needed at retail providing service to the community, unfortunately, we cannot spend the dollars on that. However, tribes across the country, including us here at the nation, are lobbying Congress to be able to utilize those dollars more flexibly. And as Bobby had noted, there are other tribes that are using the dollars in multiple different ways, and they're interpreting the legislation differently. So internally, we have our finance professionals, our legal professionals, and of course our leadership looking at the rules and guidance and making determinations about how the funds can or cannot be expended. So I hope that that's a clarification, but you can also go, like I said, to the United States Department of Treasury website, type in coronavirus relief funds, and you should be able to look at the guidance for yourself if you want, or if you're interested in reading all of those materials.
Thanks, Melinda. Are there also funds under that act that could be dispersed to tribally owned companies, and would they have to file for those funds, the small business? Or is that separate?
Under the CARES Act, there is multiple different types of business opportunities. In particular, the one that seems to be well known throughout the country is the Small Business Administration Paycheck Protection Program. Unfortunately, those monies ran out very quickly, both rounds that have been funded, but Congress is currently looking at another stimulus package. However, they're waiting to see how this CARES funding is working for everyone across the country, and they want to wait until I'd say mid-July, early August before they make a determination on how and if they're going to refund programs of that nature. Now, for small businesses within the state of Wisconsin, there are resources out there that the state of Wisconsin also received CARES funding, and they are putting together programs that allow for businesses to apply for resources as well. And some of that information has been distributed on the nation's website, has been shared internally on the communications update, and is posted on the nation's Facebook page. So search for those.
Okay, great, thank you. Lisa, I have a twofold question for you.
Sure.
One is, I'm sorry, Lisa Liggins. One is about the mail outs, people who want to get back on their mailing list or access enrollments. How can they do that? The other part of the question is, what about the elder per capita? Can you explain a little bit about that fund, its basis, and why there is funding for the elders who are 62 and older, or is it 65?
65 and older.
Okay, could you?
Sure, I'll start off with the elder per cap first. So the elder per capita was set up as a trust. So those funds aren't coming from gaming revenues. They're coming from funds that are held in trust, and the oversight is for the trust enrollment committee. The trust department has mailed out the elder 65 per capita forms. Those have to be notarized. That's a process that happens every year. I know there's been some concern about how to get your form notarized. We do have notaries available. We will be posting an update later today or early Monday with all the notaries available for the Oneida Nation. They'll be on the Facebook page. And as well, if you're a tribal member who has a bank account, you can go to your bank and get your form notarized there. So that's why we can still have a per capita for elder 65, because it's not coming from gaming revenues at all. Those are funds that are already set aside in a trust fund. What was the first part of the question?
And the other part was about the mail. How can you get on the mailing list? because they're pretty limited.
Sure.
And they didn't ask the question, but I know another question has been about IDs.
Okay. So the trust enrollment department is currently closed to the public. They're observing the restrictions in the Safer at Home and the operational restrictions we have under Tier 5 budget contingencies. If you have questions on how to get an ID, how to get a form notarized, how to update your mailing address, you can certainly call the enrollment department. They're at 920-869-6200. We also have their webpage where you can download forms to update your address. Specifically for the COVID report, that would be an update that you'd like to get on. You'd have to update, make sure you update your mailing address with the trust enrollment department.
Okay, thank you. We're running short on time. We do have, I'll take one more question. What are the areas that are currently being considered for the CARES Fund? There's some major areas. Who wants to take that question?
I can do part of it for the first part, just kind of a follow-up to Melinda's comments about small business. So the business committee at last week's meeting did set up a Oneida Small Business Assistance Program that's being administered through Bay Bank. So CARES Act funding was committed to fund that program. If anybody has questions about that, they can contact us again at the call center, 869-4481, or reach out to Bay Bank, and they also have their webpage updated with information.
And then just to answer, I appreciate that. Thank you, Lisa Liggins, for that reminder. That's one of the things we wanted to make sure we got out there for the small business owners, because we were able to set aside some money for that particular purpose. And right now, what the business committee has done is the first thing that we've done is we've reimbursed expenses related specifically to the COVID pandemic. That was the first round of money that we've identified, and I do want to thank the finance team for that. They've been working very diligently to make sure that all of the different, and with the Intergovernmental Affairs and Communication, have been working together and collaborating on making sure that we're identifying the source of funding, what the restrictions are, or the rules around each source of funding, and then how to allocate that properly. So the small business set aside is a really good example of where we've taken initial steps to say, here's some of the things that we think we can spend the money on. When I went through my initial presentation, I highlighted a few of the larger things that we've already done, where we've provided a suspension of the mortgage or rent for people who have their program is through the nation. That is an expense that comes with a price as well, and so we're doing things like reimbursing for that. Utility is another one that if you're an Oneida customer, we suspended utility payments to provide relief through this time and over the last several months. And so we're going to continue to do things and look at those types of activities to see where we can continue to do those things that support the needs of our tribal members. Again, we've done things like the food security team. They worked really hard over the last several weeks. So I have to thank again that team, all those people in the general managers areas, our Councilman Guzman and Councilman Stevens, who took the lead for the business committee on those efforts, and put together a plan, and we'll be allocating some dollars as necessary to that as well. And then aside from those things that we know are immediate and that that we've already reimbursed, the business committee does have a process now in place that we started to practice, where those requests are being filtered through a specific area, and then they'll be vetted to make sure that they comply with the rule for that source of funding. So for example, again, Melinda had indicated for us that there's 4 specific requirements that the CARES funding needs to meet. And so when a request comes in for a reimbursement or for an allocation, this team that's been put together takes a look at the requests and makes sure that the request itself meets those 4 criteria. Then what happens, it will come to the business committee, and we will help make determinations about whether or not that is going to be where we want to allocate those funds to. And so as we continue to proceed, I can't give a specific example at this point, because we're just starting to get that process moving in a way after we've already addressed the front end of the work, which was all the reimbursements that we've had to do already for those other things that we've made commitments to, such as the rent and utilities. So as we continue to proceed, we will continue continue to add that information to the reports to the membership, and specifically report. Again, Melinda indicated we're getting ready to do report 2. There will be a follow-up report after that, and we'll share that information as we can. Thank you.
Thank you, Lisa and Lisa. We always get a lot of questions about employment, and I ask you please try to remain with your concerns and your questions relevant to the presentation of the day. But I will remind you that we do have an HRD hotline. If you have questions, call the hotline. It's 490-3699. 490-3699 is the HRD hotline. And if you need to know questions about recovery, unemployment, reporting back to work, those kinds of things, you have to call HRD, and we hope they can help you. They do have a website as well. You can email their website and an email address. It's HRD_general, GENERAL at oneidanation.org. Again, HRD_general at oneidanation.org. So send those employment-related questions to them, please. Also, I just wanted to note that I know there's a lot of people, you see them out cutting the grass, you see people taking care of lawns and such. The elders, they have certain rules they have to follow. They have standard operating procedures for lawn cutting, and when it rains, they don't cut. They also only have 2 guys that do their lawn work right now. They have 85 people on their grass cutting list. So it's been difficult for them to keep up with the workload that they have. If you have an elder, if you have somebody that's on that list, and if you can, we would appreciate it, everybody would appreciate it if you would offer to help them out, maybe cut their lawn, help them out in whatever way you can to lighten the load a little bit on the home chore guys. Also, we want to let you know that the smoke shops will be opening inside the main casino and inside Mason Street Casino on June 22nd. They'll begin opening daily at 9 a.m. Don't ask me about the other ones. I only have information about those 2 smoke shops, so I don't have the answers, but you can certainly call the retail division and ask them the questions. There's formerly the Oneida Elder Services is now called the Oneida Aging and Disability Services. Again, they're not reopening their facility. They're looking at how their recovery plan will happen, how they're going to phase in people coming back and servicing their elder population as well. Right now, if you have questions, you can contact Chrissy Liggins at 869-6847. So that's a name change. Oneida Aging and Disability Services. That was formerly our Oneida Elder Services. So we want to thank you again. This has been an extremely long session today. It's, I think, the longest segment we've had, but we do appreciate your comments and your concerns and your questions. We do try to follow up and make sure that we get them answered and we get them posted on our website, the COVID-19 website. We just want to reminder to everybody of our core values. As Oneida people, we seek to be one with all creation, to be grateful for the earth and for all she provides, and to attain harmony with oneself, one's family, one's neighbors, and all humanity. We do want to wish everybody a happy Father's Day out there, to all the dads on Sunday, and please keep those little celebrations little with your family, and keep your celebrations safe, keep your gatherings small, and keep your children and your dads safe, and sanitize and mask, and be small in your groups, and remember the encouragement that we get from our medical professionals every week. So Oneida Nation, we're keeping our numbers down. We're working very hard at it. We have nobody in isolation. So congratulations, Oneida, for contributing to the safety and the sustainability of our nation. Y'all won't go?